So this is the knowledge portion of my injectables video. I will be talking about the different routes of injection medications. So the first one is the intradermal injections. For intradermal injections, you must first use a 25 to 30 gauge needle. And you also have to use a needle length of 1/4 to 5/8 inch. You typically use a 1 ml syringe and you go at a 5 to 15 degree angle. The max amount of meds given for these kinds of injections is 0.1 ml. The typical sites are the ventral surface of the forearms, the upper chest, and the upper back. So when giving intradermal injections, say it was on the ventral surface of the arm, you must first pull the skin taut. You make sure that your bevel is up. Once your bevel is up, you insert it into the skin about an 1/8 inch in until the bevel is covered. And then you inject in the medication until you see a wheal or a bleb. Advise your patient not to touch or scratch or apply pressure on the site after you do this, okay? The second one is called the subcutaneous injection. For subcutaneous injections, you must use a 25 to 30 gauge needle as well, and needle length is 3/8 to 5/8 inch. You also use a 1 ml syringe or an insulin syringe, and those are measured in units. For these insulin syringes, or for these types of injection medications, you do have to go either a 45 degree angle or a 90 degree angle, just depending how much subcutaneous tissue you can pinch. So if you can pinch more than 1 inch of subcutaneous tissue, you have to go at a 90 degree angle. If you can pinch less than 1 inch of subcutaneous tissue, you must go at a 45 degree angle. The max amount of meds to be given for subcutaneous injections is 1 ml. So for the sites for these are the back of the arms, the abdomen 2 inches away from the umbilicus, the anterior thigh, the lower buttocks, or upper buttocks, lower back. So when giving subcutaneous injections, say it was on the abdomen 2 inches away from the umbilicus, and I can pinch more than 1 inch, so now we're going at a 90 degree angle. You must first pinch the skin. You're going to go at a 90 degree angle, you insert in the needle, you release the skin, and then you inject in the medication. Advise your patient not to massage or scratch or just mess with the site. Advise them to just leave the site alone for a few days, and that it might be a little sore or it might be tender. And then lastly is the intramuscular injections. For intramuscular injections, you must use a 20 to 24 gauge needle. Needle lengths are typically 1 inch to 1.5 inches, and the angle is usually a 90 degree angle. So the max amount of meds totally depends on the muscle that you're administering the injections on. So for the deltoid muscle, the max amount of med is 1 ml. For ventrogluteal and vastus lateralis muscles, the max amount of meds is 2 mLs. And then when giving intramuscular injections, you must make sure to use the Z-track method so that we are making sure that the injection goes into the muscle and not the subcutaneous tissue. And we also have to make sure to aspirate. So now I will show you where these muscles are. All right, so for the deltoid muscle, you must first find that acromion process, which is right here. You're going to place 3 fingers below that acromion process, and then right below it is the injection site. Again, you have to go at a 90 degree angle. You have to use a Z-track method where you pull the skin firm, and then you inject in the medication. You aspirate first, and then you inject in the medication. To find the vastus lateralis muscle, you must place a hand on the lateral condyle, and you're going to place an L, and then you're going to place your palm on the greater trochanter and make another L. And then the site of injection should be the middle third of the vastus lateralis muscle, which should be right here. And then for the ventrogluteal muscle, you're going to place a hand on, see right here, you're gonna place, if you're doing the left hip, you have to use your right arm. So I'm gonna place my right palm on the greater trochanter. And then my index finger points towards his anterior superior iliac spine. My last three fingers points towards his iliac crest. The injection site should be right here. Okay, so again, make sure to use the Z-Track method so that the injection does not go, or the medication does not go into subcutaneous tissue. We want it in the muscle. And to aspirate first before putting in the injection, before injecting in the medication. And then we do teach the patient to leave the site alone and not to apply too much pressure or scratch it or basically mess with it. So we just advise them to leave the site alone and that the site will be tender and sore for a few days.